Okay, okay, great. Hi, everyone. Thanks for your patience. Thanks for everyone who's here. Thanks for everyone online. It is Monday, June 2nd, 2025. It is 4:11 p.m. This is the Boulder County Public 2026 budget strategy or budget study session. I'm Morgan McMillan, board president. With me is
Amber Johnson.
Great, and Landry is virtually with us. That makes a quorum. So I'm going to ask that we start, and then I think Lindy's joining us. Brooke is traveling, so she's unable to join us today.
Great, thank you so much. Welcome to our Board of Health study session. We usually don't do one this early in the year, but this is an unusual year, and we have been doing an enormous amount of work with the recognition that there's a lot going on in the public health world, especially in relation to budget and finance. And so thank you for coming tonight. And I really just want to start off by giving an enormous thank you and gratitude, especially to Armando and Desiree and Sarah and the finance and budget team and lots of folks on the ANF team, and also to our management team for really leaning into this process of making sure that we can develop a sustainable budget for public health. Thank you.
Go to the next slide, please. There it is. All right. Well, thank you. My name is Armando Guardiola, Director of Administration and Finance. Thank you, everybody, for showing up to this Boulder County Public Health Early Budget Retreat for 2026. Today, we're going to be exploring how we're creating a sustainable future and addressing the financial challenges while still staying true to our mission, which is ultimately the opportunity for a healthy life. So let's dive in. So here's the roadmap for today. We'll start with the purpose of this meeting and our financial challenges. Then we're going to go into the preliminary recommendation for 2026 budget and scenarios, and also the priority-based budgeting approach. We talk a little bit about the challenges, the tools we use, and overall kind of a summary of everything that we've recommended, and also kind of what the divisions have management and divisions have put together a lot of work and a lot of thought behind these recommendations. You went back. All right, so I'm going to jump right in. So I do want to talk a little bit about the structural budget issues that we're kind of trying to address, and hopefully I can give you enough information on how we are addressing it and how we're actually trying to make this sustainable budget for the next couple of years. So right now we're about 81% of our budget is tied to personnel.
And just an FYI, Lindy's on it too.
Great. Okay. This creates an imbalance and limits our flexibility, especially when we're facing deficits. So that was one of the things that we addressed last year when we were looking at the budget. So we continue addressing that and putting in place some of the controls into our own budget system. Additionally, the 25% of our revenue depends on federal funding. We identified that early January, and many of it was very stable at the time. And right now, everything that is really in federal, unfortunately, we've moved it over to more unstable. Even though we are currently receiving the drawdowns, it's still, there's just uncertainty. So I think we need to be careful. We need to address that. So we are anticipating some of these cuts in the year to come, and making sure that we have at least a plan in place to be able to address some of these federal grants. We're also confronted with the end of one-time COVID funding. As an agency, we haven't fully right-sized our operations to reflect the post-pandemic environment. So we'll talk a little bit about how we address that when we develop this budget. And there's also, so these aren't short-term challenges, these are structural, and we really need to start facing them. Otherwise, we're just kicking the can down, and where every year is an uncertainty. So what we're really trying to do is making sure that we develop a plan more long-term, 3 years. Anything past 3 years, I wouldn't recommend, but at this time, I think a 3-year is a good starting point. So today I'm going to walk you through some proactive steps that we're taking to restore some of this balance, increase the flexibility, and then also look at long-term sustainability, which I talked about it last year when we originally did the budget for 2025. And I'll talk a little bit about what we've improved and what we've added, and we'll continue growing that sustainability. Next. So I am going to talk a little bit about the past and how we got here. So our focus is for long-term resilience, ensuring that the budget strategy supports both sustainability and impact. So in the past, we've had an incremental budgeting model, which is pretty standard in government. As we evolved, it's important that we start adjusting instead of being reactive, or we're being more proactive. So what we're actually looking at now is we tweaked so incremental budgeting is tweaking lines year over year without looking at the big picture. And so what we've done in 25, we transitioned to a base budget model. As you recall, we went in there, we gave a percent, we looked at historical data, and we gave a percent of where we should be over the last 3 years, more of the actual instead of a budgeting incremental. And so we implemented a 5% reduction last year overall in our budgets, so which worked out to about 1.5 million. It was a 5% to start. We at least established some of these line items with historical data of actual use. For 26, we're actually taking that to the next level, which is priority-based budgeting. It's not a new methodology. It's been around for years. So this approach allows us to initially align our resources with our priorities, values, and the needs of the community. This shift is technical and it's strategic, and it means it's being more proactive. We're using data-driven decisions. We're using the mission to focus and allocate our funding. Excellent. So before I start with the new budget, I really want to talk about where we're at in 25. As you know, currently you get a monthly report with all your financials every month. I kind of give a quick summary. I usually recommend look at the green and red, right? If it's red, probably ask questions. If it's green, let it go, it goes. So here's the hard truth. To be solvent right now in 2025, we need to average about 2 million a month in revenue, as you can see in that diagram, in that table, sorry. As of April 30th, and keep in mind, we close on the 15th of the following month. So we haven't closed, they're working on the May close right now. So right now, I'm only giving you information until April 30th. So we currently have recorded about 6.1 million in actual revenue, which is only 31% of the annual budget, which falls about 1.9 million short. It's early in the year, so I want to be clear with that. It's early. Usually it's pretty comparable every year. As you can see, I did a comparison with the last 2 years. It's an up and down process. We've actually probably we've drawn a little bit more just because of the environment that we're in with the federal government. So nothing alarming. I'm still looking at constantly reviewing that, and we'll provide additional information. I meet with Lexi, kind of give her, this is what's going on. We're looking at the line items. So nothing that really is significant for me to really be alert or red flag right now, but we'll continue looking at that. This shortfall, though, is primarily because delays on federal funding, state funding disbursements. It's fiscal, so nothing to be alert. On the expenditure side, we are favorable. Right now, we're favorable about $672,000, which means we're underspent, which also helps us address the 25 budget in case those revenues do come in short. But we'll continue monitoring that. Really, second quarter, I'll have a better idea of where we're going to be landing, especially with the federal funding as we start seeing some of these funding. We call them funding cliffs, but we'll continue addressing those. So we're closely monitoring both revenue and expenditures and adding funding and adding additional funding received so we can make data-informed decisions. And like I said, we'll continue publishing these reports. And if you have any questions, please reach out. But right now, steady, about 1 million under, and we'll continue reviewing. Like I'm running through this. Am I going too fast? Because I'm like, all right. So here's the kind of why and how we came up with some of these recommendations. So we developed 3 scenarios for the 26 budget. each grounded on, I used the CPI trends, I used inflation factors, pre-COVID and post-COVID analysis, and federal funding challenges. So we didn't just use one tool when we did the original financial analysis. We wanted to make sure that we captured multiple to be able to come up with some realistic numbers where we really should be to be sustainable. So I'm going to talk slightly about each one. And then if you have questions, please ask, but I'll continue. So scenario one really was more originated when in January we started seeing the administration executive order come out on federal grants. So originally we kind of took that to a different level and took the 25% of what we had for federal funding, which is kind of funny because after doing the full analysis and looking at the other tools, one of our first scenarios to be really moderate sustainable, we would recommend an $18.5 million budget. With that said, that model is very essential core services, which means it would be pretty much our essential core services and really no room for flexibility. So that is a worst case scenario. Scenario two was really balance operations, and that would be at 19.5. This approach preserves key programs, allows modest reinvestment in areas of strategic need. Still with that, you'd see a disruption in services. So I think we wanted to be careful about that. We wanted to make sure that we could true up our budget, but also not have a huge impact on how we disrupt services. And then ultimately, scenario three, which is the strategic reinvestment of 20.5. When we looked at that one, this is the recommendation that we're putting forward tonight to the board, and it balances sustainability with innovation, preserving critical programs while allowing room to evolve and grow. It gives us some flexibility, and I think that's a better approach. So we don't impact our service levels. At the same time, we are looking at our strategic plan and strategic priorities and still addressing the needs of the community, and that was important. So each of these options represent a sustainable model that moves us away from the reliance on fund balance from day-to-day operations. Most importantly, the recommended scenario includes a 3.9 million reduction from the 2025 budget, realigning our financial path with both economic reality and community priorities. So I'll talk a little bit about how we got to there as far as the recommendation with priority-based budgeting. Next. Or I guess we'll go back. Any questions on those three scenarios?
Well, just a small thing.
Yeah.
The difference between the base, what we had budgeted for 25, which was 24.4 million, minus 3.9 million is not 20.5 million. Top number up there, 24.4 million.
This is change for 2025.
Oh,
Right. Change, and then minus 3.9 million.
it gets us a 20.59, 593,000.
Okay, cool. Got it. Thank you.
I just took the 93 out, but yes, it's
Got it.
All right. So 26 base budget recommendation development. So I'm going to talk a little bit about how we got here. So how do we arrive to this budget scenarios? We started with a 10-year financial analysis, looking at trends, revenue volatility, cost projections. From there, we identified 3 potential targets for 2026. So we used these targets when we started priority-based budgeting. We asked each division manager to evaluate their programs against those targets using a PBB decision tree. If you recall, it's a tool. I'll talk a little bit about it high level in the slides to come. The tool is designed to assess impact, alignment, equity, and funding flexibility. Is that when we do a feasibility test. And here's how the targets are broken up. So our first scenario was a reduction of 11 to 16%, knowing that 11% was maybe not realistic based on the environment that we're in, but we still wanted to see, where can we be at 11%? What does it do to our budget? And then ultimately 11 to 16%. We landed at the 16%. Scenario 2 built on that and added another 4 to 9% cut. And then ultimately scenario 3 reflects a 25%, which is or 25 based on the current levels. And that was really kind of more of the worst case scenario. Originally, we were targeting at a 30%. We thought that was a little aggressive. And so we wanted to be careful and really look at what was realistic to make sure that we can still operate and provide services. We'll continue to work on these scenarios as we receive update. I think somebody's at the door.
Sorry, that was my alarm that
Oh.
goes off everything.
Ring. So we'll continue to refine these scenarios as we receive updated revenue data. That's also key. We'll talk a little bit about that today. But scenario 1 is our recommended starting point. It's a strategic path forward to balance sustainability with service to the community. So this is actually, we talked about introducing the source and use really is a term that most government agencies use. And it's really the understanding of where we're trying to get to with the budget. So this year, our preliminary budget that we want to bring forward in August, once we look at revenues, obviously, as more data comes in, we would like to at least start a base budget this year for 2026 at these numbers, and I'll talk a little bit about it. So for the 26, through extensive data analysis and close collaboration with our division managers, by leveraging the full suite of the PBB tools, we proposed a $20.5 million for 2026. This represents a 3.9 reduction in 2025. Despite the reductions, we're confident that this proposal will result in minimal impact to service levels. That's because the recommendations are targeted and strategic and not across the broad range of all department or divisions. We've also identified several process improvements that will help preserve or even strengthen our service delivery, ensuring our community continues to receive the support it needs. At this stage, we left out the revenue. If you can see, there's nothing under the revenue right now. We have an idea, but it's just too early really to look at the revenue coming in. But so it was done intentionally. And so we'll refine those figures here in August when we start really start building the budget, because this is only a preliminary. And this is really just giving us a total aggregate amount of what we believe the 26 budget should be. And so during the August budget session, you'll start seeing some more projections on the revenue. So above all, the budget prioritized mandate services and high impact programs, the work that is our core mission and most critical to the health of our community. Questions on that? It's a lot.
I just want to make one caveat that there is a tremendous amount of context behind these shifts. And so, for instance, we have a number of spaces where we're thinking about reorganization. And so people may be transferring from one department to another, one division to another. And so that's going to reflect in here. So please recognize that this is a holistic look at it. And it doesn't necessarily reveal itself at first glance.
And this is very preliminary as we're still looking through all these numbers and making sure that we can get to our targeted budget.
Is this where you want questions? Are you like, you still rolling?
I can keep rolling if you want, then we can ask questions, but you can definitely keep rolling.
Do you want to jump in with questions, Amber? I mean, I know I'm stacking questions, but I'm happy to wait until the end.
Either way, I mean, I think I'm worried that you're just going to answer my question anyway.
We can do that, and then if I don't answer, definitely.
Yeah, that's all good.
Why don't we do the last fund slide and then take questions about the budget?
And then, okay.
We'll move into people.
All right, this is the slide that I've been asked since I've gotten here about fund balance. So we're going to talk a little bit high level on the fund balance. So at the beginning of 25, we started with an unaudited fund balance of about 7.2 million. That currently is still being worked on by the auditors. It's almost complete, but I'm pretty confident it'll be about 2.2 million, right around that ballpark. So that is really starting off the year with the 17% reserve. The balance of 25, if you recall, also has a 2.1 million assigned fund balance to balance our 25 budget. If you recall, that was adopted in 25. So as we begin to rebase the 26 and assume expenditures remain within budget, our projection for 26 with the fund balance about 5 million. So if we go on track and stay, 2% within budget, we're looking at about a $5 million fund balance starting 26. What does that translate to? That's 15% in our reserves and only earmarks about 1.2 million for us to use to maybe subsidize any programs that may have no revenue. That's why it's critical that we're rebasing the budget to be able to look at our flexible funding and be able to shift some of that to those programs so that way we can be self-sustained from using fund balance. It's tricky because what we need to do is not only are we doing some of these implementations in 25, which may affect how we end the year, that's going to be critical to see what our fund balance ends. But right now, if everything stayed as is with our current 25 budget, we'd be moving into 26 with a 15% reserve. So it's worth noting that with priority-based budgeting recommendations and already being implemented, we hope to maybe increase that percent for 2026. And so really is important that we stick to our timeline of implementing the 25 changes and making sure that we implement by 26 our recommended priority-based budgeting recommendations. So another key factor is the progress in revenue forecasting. We're still, like I said, we're still looking at revenue projections, which is clear, or it's very important that we make sure that we come in with revenue and true up any revenue that is not coming in to make sure that we can project where we're going to end at 26. So it's real critical. We're really looking at that and making sure that our projections are online because it's gonna really affect how we operate for 2026, and then also give us the flexibility that we may need if we're going to keep programs that maybe have no funding, but are important within our scorecard and are important impact to the community. So that's important. I also, in the slide, I included a 3-year. If you take a look at it, by year 27, we hope to be 100% free and clear of using any assigned fund balance. With that said, we definitely are doing other things in process that might not take place in 26. So for example, we have fee analysis going on, we have process improvements, and those just take a little bit of time to really see what kind of impact it does to our budget. So before we start with priority-based budgeting, I'd love to hear some quick or questions on the budget. I know that's a lot of information. I feel like I'm just talking, but I want to kind of, if there's any questions in regards to the recommended budget, it's new. It's fairly new to everybody. And so I just want to make sure I give you some time to kind of digest that. I'm going to go back one second. Or sure. No, that's fine. We can see. I think fund balance is usually the question they ask.
Well, we'll go wherever we need to go.
Yeah.
How flexible are you?
Yeah.
Amber, do you want to kick things off?
Yeah, I think one of my questions is, if we land on scenario 1, how agile is the budget such that if we needed to move to scenario 2 or 3, like how quickly would we be able to do that?
So that's a great question. So so the PBB team really worked on these tools, and I got to give credit. So Lexi actually was originally, we had targets, so we knew what kind of targets we wanted to give the division managers, but the way we laid it out was we took all the recommendations and we started kind of phasing them. So we took everything, like, let's just say it was prioritized 1 through, I think there was 1 through 78. So 1 through 78, the first 32 that we did actually added up to scenario. And then the next ones, we didn't have a lot of scenario 2s, but the next priorities in line would add up to scenario 3, which means, bare bone public health, if we lost every grant, worst case scenario, but we have a plan. So it's not like in a couple months, if something was to happen, we have the list of priorities that they provided us that it'd be really easy to kind of shift, and it's just implementing. So I'm glad we kind of did that. We knew we wanted to do something like that, but we put in place kind of a mechanism to be able to be proactive and not just, do this every time.
Yeah, that's helpful. Like, you know, the steps you would need to do in order to do
Yep.
scenario two.
I mean, we don't want to get there, right? But
Right.
but we definitely have those in our huge spreadsheet that, yeah, definitely have to go there.
Keep going.
No, I just have one more. I mean, I think when we look at the proportion of like fund decreases by program, and I think clearly community health is this largely because community health was bolstered by COVID and temporary funding because of the pandemic, and we're just coming back down to.
So that's primarily, and a lot of it is heavily funded by grants. Some of that is just sunsetting grants that, you know, we're doing that we're going to expire anyways. So that's where we saw some of that. And definitely that's a program that we want to definitely look at. How do we subsidize some of that because of, you know, the impact that as a community scored high on the scorecard. So we took a bunch of tools. We just didn't use one tool, but ultimately a lot of it was sunsetting at the end of the year, and then just the federal grants.
I guess question for you, Lexi, like within the community health budget line, like are those more opportunities for us to partner with other organizations or consolidate with other programs?
I think there are a lot of opportunities, and we're going to be having conversations with that team about like what are, you know, what is the focus? What should be the major focus of this work? How can we make sure that we're serving the community best, and really just because, I mean, as Armando said, a lot of the work in community health is critical equity work that we feel is important for our community. And so we're going to be pretty creative about recognizing, you know, where are the opportunities to partner between programs, to partner between divisions, to partner with other organizations, and really try to support that work.
Yeah, that's great.
I mean, this is a continuation on that, and you said a little bit about this, but I just want to really rewind and focus a little bit more on the impact to community from taking a 16% cut to the budget in 1 year, and then the impact on our people, you know, within the BCPH staff. So, and I know that some of this was in the notes. You mentioned, you know, sort of maintaining core services, but we can't do a 16% cut without really impacting our services. So can you talk a little bit about what that looks like at this point that we know about, and then also what it looks like impacting our staff?
Yeah, definitely. Do you want me to take a first shot or?
Go ahead.
Okay, so first of all, on the reduction, this is it's not going to have a huge significant reduction on mandate, so it's really non-mandate. But we are really methodical on how we did this. So that's why we took the recommendations. We worked with them specifically with the divisions, making sure that they know their programs more than we do, right? It would not be fair for me or Alexi or anybody on the PVC team to say, hey, this is where the reduction need to happen. We really let them really work on the recommendations. They know their book of business, as I always say. So through priority-based budgeting, we prioritize the high impact programs, mandate, and then we focus on equity programs. So each recommendation was based on data. We also looked at performance, and then we looked at the community scorecard. So it wasn't just, you know, let's choose this division and it needs to be a reduction. We actually looked at a lot of data before we made these decisions. And here's the other thing is everything does have a service level or some type of impact. And so to address that, we're going to be doing lost my mind. We're going to be doing process improvement. So we're doing a lot of lean. So we do have a list, and I'll talk a little bit about that in the next couple slides, but we do have that to address that because I can tell you that any organization still has waste. And so we have to address that. And that's the opportunity to address that so we don't affect our customers, as I always call it. That's what lean does. And so we want to make sure that we're smart and strategic, but everything is data driven. I would probably have to say. I don't know if that answers it.
Yeah, I mean, I just don't want to lose sight of what, you know, this is an impact the community, and certainly, you know, it will impact our team. And I know that we might not have all the details yet about which programs, for instance, we won't be able to do with this much of a reduction. And I just don't want to lose sight of that. I guess I want to acknowledge that it will happen as part of these cuts.
Yeah, and we're going to be, as we have a little bit more time to process things, we're going to be continuing to look carefully at what it means for service provision to the community. And when we come back to you in August, we'll be able to tell you what adjustments we've made to address that.
Great.
And keep in mind, personnel is indeed our largest, largest cost, but it's also our greatest asset. So that's something that we definitely take into account when we're looking at this data. So we're very careful. And we've been working with the division managers, and hopefully the decisions we're making will foster into good decisions and making sure they don't affect our customers.
Another question about that last slide on fund balance. What happens? So it's this is pretty big behavior change for the organization to wean ourselves off of being on that fund balance. But I think we, have established in earlier study sessions
To go
that
over
we
each one.
don't want to continue dipping into, and that we set a minimum base of 15%, right, for our reserve. So I appreciate the staff's work to get us to ensure that we're not going to dip below that. But it's pretty tight in there to stay above 15% with no assigned reserve in 26 going into 27. And so what happens if we don't get there? What does that look like? And maybe that's part of the scenario planning.
So scenario planning, if you look at 26, we'd like to not use any of it, but I still put in there an earmark 2.2 million. So I still put a little bit of it because it has to be a phased approach.
1.2.
Yeah, 1. Did I say? Yeah, I'm sorry. 1.2 million. So I did put in there just worst case scenario because we still have to. We're so dependent and we've been over the years. So that's why it's important that we get to 26, make sure the reduction is there, and then start assessing where we're at. So I did take that into account. Here's the other thing that's missing here is the revenue. Even though it's flat, I still believe we got a budget, or we got a grant office. I know division managers are pushing hard for additional revenue. So I did a flat, and it's not been flat. Historically, it still increases slightly every year, except there's a couple years that did not. So I'm still being optimistic that we still might have some increase in revenue. So I didn't take that into account either.
I would also like to brag on the admin and finance team a little bit because they have put in so many internal controls that are really helping us, like all the way from doing monthly closeouts and monthly reporting to all of our division managers about like, here's where you're supposed to be in your budget spend, here's where you are, and the follow-up conversations and the additional planning that we have going forward. It really helps us to ensure that we are precisely tracking revenues and the spending plan for reach revenue and the spending by the departments. I think that that's gone a long way to really shifting our division managers just really have a much stronger handle on their budgets and are much more able to kind of live within their means. And that's kudos to both sides in terms of a big change from what's happened in the past.
Yeah, I think that's great. And I want to emphasize thanks to the whole team and Armando for your leadership. And I think that I keep going back to this is a big cut, but it also we've been talking about it for some time. So I don't want to make it seem like the board is just sort of like, all right, let's move on through the slide deck, because I think we recognize again that this is a big deal. And we appreciate all the work from the whole staff that went into making recommendations for how we're going to get there too.
And keep in mind, it's very strategic. A lot of data is behind this. So it just, it's been months of working with, program director or division managers and just looking at numbers. So it's being strategic. So it's not easy, but I think it can give us the why. I think it's important to say the why we're doing it and how we're doing it. And I think we can definitely demonstrate that and provide that backup if we need to. So the hard part is now implementing. So we'll talk a little bit about moving forward and how do we implement this to make it successful. I know a lot of organizations try priority-based budgeting, and then when you get to the implementation, it's very difficult. One thing I would say is I prefer to have to be empowered to be able to make the reductions instead of being forced to make reductions when we don't have revenues coming in. I think this puts us at a better place to be more strategic. Any other questions?
Hi, Lindy. Nice to see you in person. Do you have any other questions?
No, I've had the opportunity to dig in pretty deep, and
I don't say a lot. It's just because I've already got my questions answered earlier.
And Landry?
Still with us. I think she was rude. Yeah, she said.
she's potentially their
I'm
airport.
trying to I'm trying to unmute. Sorry, I'm in the airport. Can you hear me?
Yes.
Okay. I appreciate all the work you guys have done. This is just a really tough time. I'm sorry that I'm in the airport traveling right now, but thank you.
Thank you for joining.
Thanks, Lindy.
All right, let's move on to priority-based budgeting. We'll talk a little bit about this. I'm gonna do some high level of kind of how we got here. But it's just really adding on to what we discussed during our retreat, when we originally had the opportunity at the beginning of the year when we really started this. So just a quick background, everybody knows we really started looking at this in December. We put the team together and started looking at the budget itself because we knew there was some structural improvements and imbalances. And so we decided to go with priority-based budgeting. And so that's kind of how the framework started, and we put the team together. And then I'll kind of talk a little bit about why. So we use the strategic tool called priority-based budgeting, PBB. For those that don't know what it is, we use PBB here all the time. This approach focuses on aligning our resources with the programs and services that provide the greatest value and impact to the community. Very important that we wanted to make sure that we were addressing the community, the impact to the community, and then ultimately making sure our resources were in line with our strategic priorities, our goals, our mission and values. So that was very important. So we took all that together. We took the framework of priority-based budgeting, kind of built it for public health. So it's kind of cool. I'd say some bragging rights. It's kind of cool that we built all these tools and started using these. So kind of really, it's been great to kind of build this from the ground up. Not the concept, but the tools and the whole thing the initiative that we're doing for public health. So why do PBB? Four things that we ultimately discussed when we were looking at it. So is maximize community impact by funding what matters most, optimizing our limited resources by ensuring dollars are spent where they have the most value. So ultimately, the public health has been working on metrics, things like that. So ultimately using that to move us forward. Support agency goals by reinforcing our strategic direction and priorities, which is very important. As I got here, we do have priorities and making sure that if we're going to say we're going to publish them, we're also going to report on them. We're going to be, we're going to make sure that we follow that direction, and then align with workload demands, ensure our staffing and service reflect actual needs and priority. And we can definitely talk more in priority-based budgeting, but we found that we do a lot of extra work. This organization, our employees do so much work. That's, at what point do we not do some of that work? What point do we not have to do that work? But they do so much work that, I understand how people feel, and the capacity feels, overwhelming. Is we do a lot of work. And so how do we align to be better fit with our resources, and ultimately using priority-based budgeting as kind of the tool behind the data to why we're providing type of service. So when we go to the board, this is the service we provide, and this is why. So that was kind of the reason we did this.
And when Armando says that we do a lot of work, part of what he's talking about is this agency's staff really goes above and beyond in so many areas. And maybe our budget just allows us to go above and maybe not so much the beyond.
So through this process, we're able to make more intentional funding decisions, reduce reliance on fund balance, which we've heard the board, we understand, and move toward a more stable and sustainable budget for 2026. So that's the why. So tools we used, this is obviously nothing new, but I'll just kind of give you a high level. So to be sustainable through 2026 budget, we wanted to be methodical and be strategic on our approach. As Lexi has shared before in her presentations, our goal is to use a scalpel, not a sledgehammer to the budget, making precise data-informed decisions rather than broad sweeping cuts. So to support the priority-based budgeting process, we developed and we used several key tools. And I'm going to go very high level. We developed the categories, which was real important. We used some of the prior counties' tools, and we really just enhanced them. So we ended up developing are identifying the categories, and they continue changing as we get better idea of what our programs are. But right now, we evaluate 80 programs, and there's and some of those are sub-programs. We categorize them at 30% mandate, 53 non-mandate, and 17% infrastructure. So that's a lot of programs. We scored it based on the strategic priorities. We made some adjustments, if you recall, during the retreat based on your recommendation and direction. And so we had them scored. And then ultimately, we had 170 decision tree ideas generated. And when I say decision tree generated, it was a workbook that they provided us, had lots of data, a lot of ideas, and that was all submitted by the division managers. Sorry, I'm still going, hold on. The other thing I want to talk about is, I don't have it, or the funding metrics. So that was the one that was a little bit more challenging as we continue to dissect our budget. And so we built this funding metrics that really pinpointed federal perceived reliable funding. And that's changed now, but that's how we kind of originally labeled the funding. Reliable flexible funding, reliable non-flexible funding, and unreliable or short-term funding. So we categorized all our funding to be able to come up with a metric that kind of really showed what every position or every program was under and what type of funding it was funded. And we actually have numbers on the funding. We're working on that because some divisions budget slightly different. So we'll continue to improve that as we continue budgeting. But that was the big tools that we used to get most of this work done. So I'm going to talk a little bit about the philosophical priorities and what really guide us to get to this budget approach. So first, programs with the ability to generate sustainable revenue should be self-sustaining. That's not as easy as that phrase, just to let you know. We're still doing fee analysis. We have to kind of determine what is a good number to sustain, because we are government. So keep that in mind. So these programs are expected to cover their own cost without relying on general fund support. Example, anything that's fee funded, vital records. So we're really looking at that, doing the analysis and saying, what do we subsidize and what are we willing to subsidize, or what do we have resources to subsidize? Otherwise, we need to make adjustments. Next, we looked closely at mandated services to ensure that they're operating at appropriate service levels and supported by our revenues. That's another thing, is these are mandated. A lot of these were directions from the commissioners in programs that they've either adopted. And so we want to make sure that we are right sizing those because, as I said earlier, is we do a lot of work. So they give us a program, but they only subsidize a small portion of it, but then they expect us to do the full program. So we really got to start looking at what we provide and what resources we have to provide those services. And then from
Just that's a quick question on the mandated program. So did you guys also evaluate whether you think these mandated services are still necessary? I think sometimes things can go into perpetuity. They may or may not be serving a community need anymore, however you might measure it. Did you guys evaluate that as part of this decision tree process as well, regardless if they're mandatory or not?
So we did.
As part of the scorecard.
Yeah, that was part of the scorecard. So we looked at them. We even had some that are so questionable that we actually had to reach out to legal and gave us either where the regulatory was or compliance. So yes, because we had questions that some maybe our division managers thought they were mandates, but they really truly weren't mandates. They're non-mandates. So definitely exploring that. I think as we do fee analysis more, I think the next step or iteration would be is looking specifically at how we staff those programs, because I think what we did is we looked at one of the fee programs, and I think we were understaffed based on what the regulatory from the state was. So those are the things that we're also discovering that we need to address.
And just, are we feeding some of that into the policy part? Like, I'm assuming that in some cases you found things that maybe weren't necessarily meeting a need, or maybe not. But if they weren't, are we having that conversation kind of in parallel, which is?
We are.
Okay.
Yeah, it figures into the recommendations. I will say that there are some areas that are mandated where we receive fees that we don't set.
Right, we have no control over
No.
restaurant inspection fees. For
And the practice across every LPHA in the state, and certainly in the metro region, is that that they subsidize those programs. And so we've also we've taken an analysis on like how many staff in those programs do other public health departments support. We've looked at the CDC's workforce calculator about what they think what they think our staffing needs are. There's no perfect answer, but what we really want to pay attention to is that in our mandated work in particular, that we're not overshooting the service level to the community in one space and dramatically undershooting it in another, but we're trying to kind of be attentive to what is the community need and kind of taking a look at how resources are being allocated to those various programs so that we can support them relative to each other and to the community.
Did you find any programs that were just simply a recommendation to not continue, even if they're mandated?
I don't think we're prepared to talk about that right now.
Okay, got it.
All right. And then for the next priority was for non-mandated programs that rely on dedicated grant funding. We made sure that they're right-sized. And so we wanted to make sure that we had we also made the expectation is that we have a clear plan to sunset if those revenues were no longer available. That's really more of the federal funding, making sure that we had a plan moving forward in that expectation. And then lastly, we recognize that high priority programs, especially those with significant community impact, may not be fully sustainable. And so in those cases, we are willing to subsidize, ultimately bringing, forward to the board when we adopt the budget, maybe having a further discussion of what is that subsidized, what does it look like, and what are we willing to subsidize?
And when we talk about subsidizing, we're talking about using our flexible funding to invest in those areas. And ideally, what we want is to be building a plan so that programs, even those programs, are self-sustaining at some point, so that we are working on the revenue generation at the same time. We're really focusing in on what is the community priority work in this space.
So these frameworks ensure that we're aligning resources with our values, maintaining financial responsibility, and preserving key services that matter to our community ultimately. Next one, Pat. Thank you. So I'm going to talk a little bit about the progress that we've done since our last budget session. So we began defining the 26 budget targets and identifying strategic tools and how we support decision-making and anchor it into our priority-based budgeting framework. We completed the program inventory, categorized all our services as mandate, non-mandate, and infrastructure. We also completed the scorecard, scored it based on your direction. We also supported the decision trees, which kind of gave us a lot of information from the division managers. And we also tested those. So we did a feasibility test on all those. And there was 130 recommendations. And we pretty much went through every single one. We spent hours together. We probably hated each other in the room for a little bit because we talked and agreed or disagreed. But we used the data to really see what was feasible. And then we actually tagged those specifically. For example, we tagged them green. Those are feasible. We can actually accomplish those. Dark green was they're already in process, things that our people are already doing. We also identified revenue generators, ideas or recommendations that will generate revenue. Unfortunately, those don't help the 26. It'll be more at the end of 26 and 27, and then process improvement. So we've literally spent hours doing these feasibility tests, and then we went back to the division managers for them to give us feedback on what we provided them. And then we went back again, and then we finally talk about where we're at. So a lot of work, a lot of spreadsheets, and then a lot of data. But I feel comfortable that everything that we're moving forward has the data to support why we're moving forward. Next one, please. So real high level, kind of give you a preliminary, or not even a preliminary, kind of a summary of what we looked at so you can have an idea. So we received 130 recommendations submitted by the divisions as part of the priority-based budgeting process. Out of those, 78 were focused on personnel services. 21 were targeted operating expenses, and 31 were proposed revenue enhancements. The recommendations covered a wide range of strategic strategies, including restructuring, retirements, attrition, process improvement, new or strengthening partnerships. Once all the recommendations were submitted, like I said, we evaluated every single one. So for the vetting, once we vetted all those, we move forward, and I'll show you what we move forward with and how we're kind of implement, or we plan to implement, but I wanted to make sure the board is well aware of what we've kind of done to get to this initial first 26 budget.
And I just want to make one addendum, which was that some of the recommendations did come from the director's team and from the management team talking with each other. So there were some recommendations that fell outside of individual division manager recommendations.
That was on top of that, right?
Yep, that's how you get from the 130 to about 176, I think, was the division director's team recommendation.
Oh,
Yeah, that's why I only want to talk about the.
Gotcha,
I can
gotcha.
back that up. The other ones we added some. Next one. Okay. So I want to talk a little bit about the recommendation and how we're implementing. So after evaluating all 130 recommendations and also the additional ones that were collaborative amongst the PBB team and also the division managers, we decided to go with scenario one. That was the option that I believe had the least community impact while still achieving our goal of a base budget of 20,500,000, and it's reducing our budget 16%. So out of that, this approach, we identify 17 items that are already in process, which are which included federal funding grants that are either sunsetting, COVID funds that are also sunsetting. We also had some staffing changes. So those are already in process. We went from scenario one, which we selected 32. So out of 130 and then the additional, so out of 168 recommendations, we went through that list of scenario ones. And so we are recommending 32 recommendations to get us to where we need to be. This includes term limited positions, retirements, attrition, resizing programs, targeted reorganizations within divisions. And we can go into detail as we get closer to moving out a full detailed budget. We also prioritize 32 process improvement initiatives, which will begin here soon. We've already actually started some of those, and I can talk a little bit about some of those. But ultimately, with the process improvements, they just take time. We also our business operations manager is doing the black belt. Actually, Patrick's actually going to do the black belt to help assist with making sure that we're implementing some of these programs or some of these recommendations for the process improvements. And so, in addition, we also selected 28 revenue enhancement projects or initiatives. These are critical to long-term sustainability, especially looking at 27. So I'm just being real clear. I want to set the expectation. I don't expect those in 26 as they take time. Examples, we have some fees that are going to slightly move every year or increase. So we'll see the increase in the revenue. So taking those into account, making sure that we account for those, and that answers your question earlier, the fund balance, that's how we increase some of that fund balance.
Armando, this was a question that I had when I looked through the materials. In my experience with process improvement, there are things that you can do pretty quickly. So can we put a finer pencil on that before we approve the budget in August to look at whether there's things that we can commit to in 26? I think my indication is it's still kind of early. You're still doing the analyses with your process improvement experts, but to me, that feels a little non-committal. And I would be surprised if all of those recommendations, nothing could achieve some sort of savings in 26. Can we look at that a little harder?
I'm actually going to promise a little bit more. So we've already started the 25 process improvements. So for example, we just completed an innovation. We call them innovations. kind of we copied Denver's term because I know people from Denver, but so we did the grant innovation. So now it's all automated, so it's saving time. So it's called soft cost. So what I'm trying to build is I should have something built here within the next couple months. You'll be able to see soft costs and hard costs. That's important to me. So for example, the soft costs, Patrick actually did this innovation. So we automated the grants. He worked with finance. It started off as a refresh, but then we went in there and we implemented it. We're piloting, but it'll save us the cost of how long it takes. And so that's all soft costs that we want to be able to take, because what happens is with that soft cost, we can use it in other departments, that cost. So yes, we already started that. We have a bunch. I can go over a list of some of those, but I could definitely provide maybe even those as we start moving those forward during the reports. We could definitely know what we're doing as far as process improvements. We've also did the landscape for the admin. We went in there and did a capacity study. So I could tell you the capacity that the admins are at an average. It's based on a process analysis. It's not perfectly to the max, to the capacity point, but it gives you a good idea and how we can restructure those. We did with vital records. We're doing we're doing cross training this week. Actually, it started. We have the person from Longmont, one of the vital records, is actually in Boulder to start learning how to train and to do the standardization work. That's one of the things in process improvement and standardization. And so she's here all week. We'll be able to do online. We're also working with Broomfield. Broomfield, we might add 2 days a week where we actually process some of their vital records to get additional funding, which is revenue generation. So we're looking at all that, and that's just what we've done. And then this is just an extra 32 that we have with other divisions, but I can give you, I think that's important. So you can kind of see the soft and hard costs.
Yeah, I think what I'm wondering about is, can we see it in terms of its flow through to budget impact in 26? Is there
Absolutely.
anything that we can quantify? I understand it's difficult, but there's got to be certain things where you could say, even if it's like a nominal impact, because I think that when you set targets and you start to say, we're going to need to go find these dollars in process improvement, it motivates people to really look hard. And so I just, that like vague timeline doesn't sit well with me. I think if we can kind of push ourselves a little harder to say, let's see what we can recognize in 26. Again, I understand sometimes it's hard to quantify immediately.
Yeah, I can definitely provide. You'll see once the dashboard for the soft and hard costs, you'll see the dollar amounts, because that's what will really translate into 26. And you'll be like, oh, you guys say 50,000 doing this, now we're going to be here. But definitely, we can definitely get that.
So it sounds like there's things that have already happened that you factored into the budget, but these 32 are, you've said.
Those are not,
Right.
we still have to explore those. So
Right.
the next step is really prioritizing those because they take time, and we want to take the ones that have the most impact, to your point,
Right,
to make
and-
sure it helps.
Right, okay.
So as shown on the table on this slide, every division contributed and has skin in the game, working together to build a sustainable financial future for public health. I'm going to talk about scenario one because that's really where you're going to see the majority of this 16% reduction. So I'm going to talk a little bit about the 32 recommendations and how we got here. So out of the 32, we're proposing to meet a 3.9 reduction in the budget. So those changes they need to be implemented by January 1st, 2026. And actually has to be slightly before that to get the budget adopted right around December. In order to really hit that target. Importantly, no major impacts are expected to mandated service in service level for mandated programs. We'll provide more specific program level details in the August budget study session. And some of the changes will be carried out into 26 as a phased approach. So not only are we doing the 3.9 scenario, there is some that are actually going to take us even further slightly in 2026. It's more of a phased approach on some of those just because of the timing in those recommendations. And that's on the operational side. On the personnel side, we focused on structural reorganization designed to improve efficiencies and to better align resources with agency goals. Attrition, planned retirements have been carefully factored into our staffing plan before any layoffs. In some cases, vacated positions will be refilled. It's just a strategy. We're just trying to provide more support, working with HR. We just want to make sure that we minimize the disruption and ultimately achieve the savings. And then wherever possible, we're prioritizing internal hiring to retain institutional knowledge and support staff development. And through this thoughtful strategic move, we're moving to a more sustainable budget. So a little bit more on the process improvement. Probably heard everything I just said, but I'll kind of repeat it. So I'm going to talk a little bit about the process improvement and revenue generating recommendations. We've achieved 32 process improvement opportunities, all aimed to increase efficiency and optimize staff capacity across the agency. We'll bring back the dashboard in a little bit more detail so you can see how it affects the 26 budget. Alongside, we have 23 revenue generating enhancement ideas. We really got to reevaluate those, though. I just want to be careful with that because really we want to evaluate the return on investment, long-term sustainability, and that has to do with a lot of more like the analysis. So we have to make sure, are they realistic and what are they going to generate? So definitely look at those. The efforts prioritizing in the fall 25. So I'll bring more information, maybe a timeline of so you can start seeing how we're implementing those. And then as part of the whole comprehensive generating of revenue enhancements in the process improvements, I'm also doing a comprehensive fee analysis across all programs. I think it's important. We haven't done it. Maybe it was done in the past, but I couldn't find any information. I think it's important to actually know, identify what are we subsidizing. So when you ask those questions, we could say, this is what we subsidize. This is what is not subsidized. Do we need to change service levels? What do we provide? What's our ROI, right? We're government, but it's important to understand the ROI at the end of the day, especially in the environment that we're currently in. So that's what we're running. We have one of our budget individuals running the analysis, and we'll have that available also. And so just some quick, I talked a little bit about the automation of the grant intakes, what Vital Records is doing. So these are just the first steps as we continue to implement and scale these improvements. We expect to see, both fiscal and operational benefits across the agency, but I'd like to be able to give you numbers. I think that's important, not just say we're doing it. I'd like to say, this is what we're saving. These are the soft costs, hard costs, and here's the efficiencies. Okay, this is something new that I'm working on, that we are working on as a group, especially with the PBB team. So hopefully it's not new concept, but where I came from, I had to work across in the city manager's office with a lot of the agencies. And so everything we did with outside agencies like South Adams Water, we did it with the fire department. It was the IGAs. And so I think when I got here, I was like, okay, what are we responsible for? What's my role? And we didn't have anything. And Desiree's like, well, this is what we have. Is 1980 was the very first one. In 1980, this is not a new concept. In 1980, they actually had a pretty decent IGA. It really had, retirement. It had some financial components in it. And then in 2008 or 2009, Patrick gave me the most recent one, and everything was pulled out. So there's nothing in there, just very high level, which is great. I'm very structured. I need kind of guidance. I need to know, where I stand with things. And so I went to Lexi for her support and said, hey, what do you think if we update this IGA there's pros and cons. So I just want to be clear. There's pros and cons with IGAs. But I think if we're running a business or our agency, in a fiscal responsible way, and I'm okay with putting it out there. So what this IGA really does is it formalizes the county's commitment to support public health, creating a clear and stable partnership. Since I've gotten here, I've heard, back and forth, like, what are they going to support? They're not going to support. What are they going to give us? I like to know where I stand with them and get a better idea of what are they willing to put out for us. At the same time, what are we willing to put out also? So second, it eliminates the annual uncertainty that comes with relying on one-time funding. Since I got in here, it's all I hear, and it's difficult to plan. And so I want some certainty. I don't know if I'm going to get it, but I'm going to try. And then third, to ensure transparency and accountability, both the county and to the community. And I think this board has asked since I've been here, I've heard that you want, that constant transparency, that accountability. I've heard it from Lexi. And so it does expose us a little bit, making sure that we are on our A game, making sure that, we say we're going to do something, we're going to do it. That's what the IGA does. But at the same time, it guarantees us some financial safety net is what I call it. It also provides a foundation of support of constant delivery and equitable and sustainable services. So it's not a new concept. We are working with county individuals. We've worked with the attorneys. I provided you a draft. Keep in mind, it's very draft. There's no figures in there because ultimately both parties have to agree. So we'll come back to the board, but I do today want to, let you know either I have the support or do we not move forward, but that's a discussion that we can have in the next couple slides. But ultimately, we are trying to get an IGA. If I get your support, we'll definitely keep pushing. Next slide.
So Armando, just to clarify though, who signs the IGA? Who's ultimately on the hook for the IGA?
The board and the commissioners.
Right. So I would say just framing your language, this is a board document that ultimately the board will approve.
Absolutely.
And will negotiate with the BOCC. So I think, I know I talked to you guys a little bit about this earlier today, but I think we want to be very careful in how we're framing this, that this is a very preliminary conversation. The Board of Health has not had the opportunity to discuss their preferences on the IGA. And then we certainly have not had that conversation with the Board of County Commissioners. So since we're on public record right now, I just want to make sure everyone understands this is very new to the Board of Health.
Yes.
We've had no input on this at all. And I, by the way, really appreciate you raising this from the point of the budget, but it's broader than the budget, right? It's an agreement across, our agency to the county. So I appreciate you initiating it. I'm really glad we're having this conversation, but I just want to be very clear about where we are today as a board, if that makes sense, Morgan. Okay.
Absolutely. So we'll continue, like I said, very preliminary. So more to come. And like I said, we'll bring anything forward once we get more information.
Can I just clarify that statement that you made? So when can we just get more clarity on the process itself?
Yep.
Just so I'm clear on what you mean by that.
So next steps are we are actually going to be meeting with the finance or the CFO from the county. We've already met with legal. We provided a draft to legal. They red marked it. We cleaned it up, making sure that all legal terms are there.
And that was really focused on the content and not amounts, like what are the components that
Right.
should be included.
Right.
And so that's next steps. We're also meeting with the county administrator also. Leo advised us not to bring in the board or the commissioners yet because we'd have to do a public meeting.
Mhm.
And so they want us to kind of talk about it and maybe more on the specifics of what we're looking into the IGA and then bring back to each board individually, because ultimately if we bring both y'all together, it has to be a public meeting. We don't want to do that in public. We want to make sure that we discuss any figures, terms, or any clauses in there that it's not in public. We want to make sure that you agree, our board agrees, and then they can take it to their commissioners and ultimately come back together with a product that both agree on, and then we can move forward. So that's the process.
Have the county commissioners, are they aware of this at this point?
Jana was going to have a discussion. So we did a very preliminary, and Jana was going to have a discussion. That's why they set up a meeting and they're willing to meet next week. So I don't know, I can't answer that question, but we did meet with Jana
We wanted to make you aware
first
that
before.
we are looking at this, and there's a long process ahead, and we are just beginning to explore it. So we are very early, and we just wanted to let you know that we are hoping to really explore whether the commissioners would be willing to sign a new IGA.
Very preliminaries.
Yeah.
I think that's yours, Lexi.
All right, so we are looking forward to the retreat with the Board of County Commissioners. This is the end of our PBB discussion, so if you have questions on
Oh, yeah.
PBB, maybe we'll take them now.
No, I do want to again say thank you for all the work because there's so much work that goes into this and it's kind of a privilege to have the time also to be able to do this rather than reacting in a moment. And so it's great that it has been such a thoughtful and strategic process to get us to where we need to be more sustainable. So appreciate that.
Yeah, and I'll just pile in and say, I know this was a huge team effort by a lot of the staff. And I want to just say thank you to the staff for being bold and brave and bringing ideas forward that I think in many cases probably weren't easy to talk about, but I really appreciate the team looking at this as an opportunity for the agency. So thank you for that.
Thank you.
Okay, so looking forward, in a couple of weeks, we'll have a retreat with the Board of County Commissioners, and we just wanted to present some ideas about the draft agenda. This does not have to be finalized tonight. We are hoping that there is nothing that is presented in that meeting that you all haven't already seen or discussed that you would want to see and discuss prior. This is not a retreat to make decisions. It's really a retreat to update the Board of County Commissioners on what's happening in relation to all of these points up here. Really looking at kind of an update on where we are with the state and federal impacts to our budget, how that affects our finances and our budget plans, going through a review of the PBB process and high-level outcomes with them. We will also want to highlight a number of the governance improvements that we've made over the last year, because that is a particular strategic priority for them that I think that they'll be interested in hearing about, especially in relation to management of the budget, transparency, and accountability. We'd like to share with them how our BCPH vision and culture development has shifted over the past couple of years. I think that's really important. I think that we're a much stronger team than we were a couple of years ago. We will introduce this history of the IGA and the need for an updated IGA, and then allow a general discussion on what the county's budget instructions are for 2026 and our relationship. So no asks, no requests, no decisions, but this should set us up nicely to be able to reapproach the county in a few months.
As we wrap up today's presentation, I want to take a look ahead and share a vision for a sustainable future. One that ensures public health can continue delivering high impact service while staying fiscally responsible. We'd like to open the discussion with the board and ask for some major, or actually two feedback that I'd like to hear from y'all is support for approving a strategic reinvestment scenario, which sets the budget at the 26 budget at 20,500,000. Endorsing the implementation plan phases so we can begin moving forward with the recommended strategies and recommendations. And then finally, are our priorities aligned with yours? And do you have any considerations or feedback on the strategies that we proposed? I think your insight is critical as we continue to move forward to really build a 26 budget. Questions, concerns, are we there? We hit the mark, do we not?
Like if you did hit the mark, I know we have other scenarios that we may need to consider. So I appreciate you. I think you said that at the beginning. I also very much appreciate we stuck to a 15% reserve mark, which is, I know, very important to the board. So I'm really supportive, and I think I rely heavily on this team and the staff to tell us what the right priorities are for the organization and our community. So to the extent that I can weigh in on that, I think generally it looks right-sized, but I think to Morgan's point, I think we also should be careful about where we may need to be clear that we need to reduce service levels just because we simply don't have the funding to support certain programs, even if they continue to be a priority. So anyway, but thank you for the work. I'm happy with moving forward with scenario one at this stage.
Okay.
Yeah, I agree. I mean, again, I just keep saying there's a lot of thought that went into this, so appreciate the recommendation also that aligns with what the reality is to our fiscal status.
I agree. I mean, I think we all agree this is necessary work, but it's really ambitious. So what are the mechanisms for feedback to the board on like, are we on progress or are we like exceeding or falling short?
Right, so we are going to dive back into this in August at our budget study session when we have the kind of final recommended budget with some more details. And I've been thinking maybe you would like to have updates in our director's report for Board of Health on progress in relation to implementation. Does that sound appropriate?
I think along with that, and this might take a little bit longer to get data on, but you know, again, how are our services being impacted? So if we have certain goals in terms of the KPIs that we've referred to for our outcomes, you know, as a department and then in the community, we want to make sure we're tracking those to ensure that we're not seeing huge shifts in what we've established as our goals as a department.
Thank you. That's great.
Else? Not, I'm gonna read this thank you to my to people. So I just want to take a moment to thank everybody. The budget team, thank you. I know I've been pushing and getting analysis and things in line. The PBE team, I know y'all hear me all the time. Lexi also for supporting that. And the division managers and supervisors for your hard work. Y'all provided a lot of information and it's not easy. So I just want to thank y'all. And then ultimately, overall, just our staff and employees for all their hard work. So we'll continue working towards, you know, really making public health financially sustainable. That's it.
On to motion to move to executive session. You guys have any directions there?
Yes, we do. And thank you again to everyone before we move into executive session. Thanks.
And we do
Thank
that in Kate's on the way. But we'll end this meeting and then we'll restart.
Okay, but first we have to do a motion
That's right.
before we end this meeting. Let's do a motion.
Exactly.
Make a motion?
That would be so
Okay.
helpful. Thank you. I'm just sliding this over. It would be great if you could do that.
Thank you for that.
I move to enter into executive session pursuant to Colorado Revised Statutes CRS 24-6-4024B to receive legal advice on specific legal questions regarding anticipated budgetary constraints and resulting personnel changes. The executive session will not be recorded.
I will,
Get a second?
yeah, I'll second that.
Great.
And then we have to do all in favor.
All in favor?
Do that.
Thank you. Sorry, no, that's okay.
Aye.
Aye.
Nice, okay. So now we will adjourn the study session and move into executive session. Thanks, everyone.
You want to do it here? Because I